The title of this case report is the implementation of hospital bed adjustable footrest for restoring and maintaining optimal ankles range of motion in bed-bound individuals. Optimal ankle range of motion is essential for basic functional mobility, ranging from high-level tasks like walking to lower-level tasks like maintaining proper sitting position and performing functional transfers. According to Kendall, the minimal necessary range of motion for standing is 0 degrees of dorsiflexion, and Kwon et al. Measured 22 to 25 degrees of dorsiflexion as being necessary for proper sit-to-stand transfer. This is why the ankle plantarflexion contracture is a significant impairment, imposing functional limitation on the participation in the majority of daily activities. Ankle contracture is a common condition seen in the individuals with overall decreased mobility, and even more so in those that are bedbound. Neurological impairments like brain injury significantly increase the chance of developing ankle contractures through pathological increase in the muscle tone on top of the decreased mobility. Treatments of ankle contractures include surgery, pharmaceuticals, casting, and positioning devices. This case report investigated the efficacy of the custom-built adjustable footrest in restoring and maintaining optimal ankles range of motion in a bedbound individual. The subject of this case report was a 69-year-old male who had suffered a massive cerebrovascular accident 3 years prior to the initiation of this report. He was seen for home physical therapy and was discharged in December of 2019 due to lack of progress necessary for the medical insurance approval of further treatments. At the time of discharge, the subject required moderate assistance for sit-to-stand transfers, primarily for forward weight shift due to the lack of ankle dorsiflexion. For the same reason, he required moderate assistance to maintain static standing. Another measured outcome was the distance from the plumb line to the greater trochanter, which was measured at 6 inches in the beginning of the intervention. The subject was continued to be seen pro bono, and the implementation of the footrest started in February of 2020. The measurements were performed once a week, but were interrupted after the first 4 weeks due to the COVID-19 lockdown. After 13 weeks, upon the resumption of the measurements, a slight setback was noted, which was likely due to lack of regular physical therapy treatments. Nevertheless, all the outcomes of interest returned close to pre-interruption values in the course of 3 weeks when this case report period ended. The collected data showed a progressive decrease in both ankle contractures, resulting in improved forward weight shift and decreased assistance with sit-to-stand transfers and static standing. The distance from greater trochanter to the plumb line also decreased from 6 inches to 4 3/4 of an inch. Based on these findings, the investigator concluded that the footrest was effective in producing the intended effects. Due to its versatility, low cost, and ease of use, this footrest can be a valid option for the treatment of ankle contractures. Thank you.